Hi, my name is Carmen Contreras. I am psychologist. I am working in Socios en Salud, Partners in Health in Peru. I am 2020 fellow lead. And since 2003, I am working in different projects in tuberculosis and HIV, in community health. In 2009, I started different projects in mental health. The last year, I received one email to my colleague in Boston, and she suggested to me to apply to this fellow. For me, to study in Harvard is, in my mind, was so difficult. But she insists to me that I need to present because she saw that I was having different abilities in my job. I work very hard in my letters, and to ask to my boss, to Dr. Meche Becerra and Bepi Raviola that provide me the different letters. Yeah, but all people was so happy that I applied to this fellowship. I think that this fellowship is a good opportunity for me because in Peru, for the majority of people, is one dream, is a good challenge to apply to Harvard. No? And I say always that this is the most beautiful opportunity to study with yours in this university. This is my dream. My first course about the persuasive communication, oh my goodness, was incredible. No, it was my first opportunity to study with different people, more than 60 people in the course. It was very interactive. I enjoyed a lot. The teachers and the colleagues improved to study more and more. And I think until now, this is my favorite course. Olivia always is invited to us to participate in different small courses. For example, when I hear about the negotiation, or to her, to Jacqueline, when she improved our skills in to have more abilities in our leadership, is so interesting. All these courses inspired to me to work more in my country, to work more in communities like Africa, like Afghanistan, in different opportunities to improve the mental health. I'm so grateful. I appreciate all the support that the fellowship is provide to me at the moment. I think is a big opportunity to different persons like to me. Esta beca es totalmente diferente. Esta beca es el sueño de muchas personas como yo, que tienen muchos años de experiencia en el campo, que son mujeres, líderes y que reciben el premio de pues trabajar mucho en el campo. I try to say in English that it's interesting that this fellowship see different people that are having a lot of experience in the field. I think it's a good opportunity for different women like to me to apply this fellowship. I work very hard with Jacqueline about what happened with me, what happened in the field, what happened in my job, what happened when I need to interact with my mentor. And I am working in that. I am trying to remember all the recommendations that Jacqueline told me. In Peru, we are working with different psychologists. In the last year and in this year, I was working with 100 or more people in mental health interventions, but I need to work more in myself every day, every week. I need to reflect and I need to continue. This fellowship, in all the months that I are working in different courses, in different activities, I identify some gaps that I need to include in my job. I have another vision in my work. I have another mission in my work, because it's so interesting that we learn to recognize what is the next step in our career. For me, this is the most important. The third challenges that I having is to work in my organization, but very close with Minister of Health. Mi tercer reto es incluir todo lo aprendido, no solo en mi organización, sino a nivel de todo el Perú, a través de asociaciones con el Ministerio de Salud. Porque todo lo aprendido no solo tiene que ser en algunas comunidades o en algunas ciudades, sino tiene que ser a nivel de todo el Perú. La experiencia que he recibido en salud mental comunitaria quiere ayudar a que muchos, si no todos los peruanos, puedan tener acceso a una salud mental comunitaria.